it's Dr. Erica. Thank you for joining me. This is Dr. Erica, pharmacist and owner and founder of Millennium Pharmacy. Thank you for joining me on this particular video. Please like, share, and also subscribe if you haven't already. Now, this particular video is an important video, like all of them, because it's to talk about the new medication, Norgestrol, also known as Opill, which is going to be newly on the shelf, over the counter, come 2024. Now, this particular new FDA approved medication is approved as of this month. I want to say it's June 29th, actually. And it is a over-the-counter Norgestrol, progesterone only. No estrogen is found in this product. No estrogen at all. So it's purely progesterone, which is healthier for patients who use tobacco, patients who have cancer, patients who have a history of heart attack and stroke. This new contraceptive is going to be better for those populations. So I recommend it for patients who are also over the age of 35. Now, because it does not have any estrogen, it's a little bit safer because it only contains one active ingredient. Now, there are some side effects to the progesterone or Norgestrol, and that's going to be acne or facial acne, and then also you're going to have facial hair growth. Facial hair growth along the chin line, unwanted hair growth in areas of the body. And then also, thirdly, there's going to be a side effect that is known for progesterone, and that's going to be your acne, and then it's going to be your unwanted hair growth as well. And then there might be agitation or anxiety as well with this particular product. Also, patients can take this particular over-the-counter active ingredient in a 1-month pack, a 3-month pack, or a 6-month pack. And it is available for all ages. Yes, that is correct. It is available for all ages. No age restriction for this particular medication. The medication is available over the counter, so there's no restrictions as far as someone needing to pick up a medication or speak to someone. They can be inconspicuous. They can be anonymous. They don't have to talk with the pharmacist or anyone in the pharmacy or the doctor's office. It's totally private, and it's totally dependent on the purchaser. Now, the product is also not covered by medical or prescription insurance. So do please be aware of that as well. There's no prescription insurance that's going to cover this particular over-the-counter medication. So that's the new update that I wanted to give for Opill or Norgestrol. And I want to also encourage this particular contraceptive for patients, again, who are having issues with the estrogen component of their normal contraceptive. So that is the population that I would suggest it for as a healthcare provider, knowing the risk of estrogen use, especially for patients who have a risk of gallbladder cancer, breast cancer, ovarian cancer, patients who are over the age of 35, again, and then also patients who use tobacco products. And I want to recommend it for patients who are postpartum, who's recently had a child, and are breastfeeding. I recommend it for those populations as well, because it does not contain estrogen, which could be given to the breastfeeding child. So I do recommend it for patients, again, who are postpartum and those who are breastfeeding. Now, there are other progesterone contraceptives that are injectables and that are given once every 3 months. And it is prescription only, and it is covered by the prescription insurance. The only difference is that it is an injectable, and it's progesterone, and it is a prescription medication. So it's not just something that someone can go and get over the counter. They actually have to have a written prescription. And that medication is also given in the doctor's office instead of at home. Now, the Opill OTC item is tablet form. It's totally tablet form. It's 0.075 milligram of Norgestrol, which is a third generation progesterone, or a second generation progesterone, excuse me. And it is, again, going to cause a few side effects, unlike the estrogen component. So do be aware of that if you're deciding to take Opill once it comes on the shelf in 2024. Also, when you purchase this item, again, remember that it's not covered by prescription insurance. It's cash paid only. You may find some good coupons online or vouchers online to help reduce the cost if cost is an issue. And then also check the Opill website once it's available and the item is available for purchase. Opill.com usually is what it's going to be known for. And then also check FDA website as well for any updates that you may come across. Now, I also want to talk about in this particular podcast, besides Opill, I want to talk about Ozempic. Ozempic is a sodium glucose co-transporter 2 inhibitor, which means that it's going to help with patients who are dealing with diabetes types 2. Now, it also helps with organ system functioning, such as the kidneys and the heart. It also helps patients maintain a healthy outcome and survival rate. They have less hospitalization and less cardiac events. So Ozempic is only indicated, approved for that particular reason. Now, have you heard in the media that Ozempic is being used for weight loss? Well, that's something to be said because Ozempic is not officially approved for weight loss. If you know someone who's using Ozempic, or you yourself may be using Ozempic, I would encourage you as a healthcare provider to refrain from using this item, although it does effectively work to reduce fat content with proper exercise, proper dieting. It is indicated for that when a person also has diabetes. So if you're completely insulin healthy and you're producing insulin regularly and you just want to lose weight, Ozempic is not going to be your choice because of the adverse effect of weight, extreme weight loss, and then any type of complications that may produce afterwards. The manufacturer has put out a statement that they are not responsible for any outcomes that may be adversely experienced due to Ozempic. So I do want to make note of that. Also, I have another video about Ozempic previously talking about the same topic. I wanted to reiterate that in this particular podcast video, continuing education and mindset, that Ozempic is not a weight loss medication of choice, although it's very popular in the media. Medication of choice, although it's very popular in the media, there's a lot of under the table items that are being passed around for Ozempic. It is being utilized in a way that stops a lot of other patients from having access to it. So patients who really need this Ozempic injection are not being able to have it or receive it from the pharmacy as they are prescribed because the manufacturer cannot put out enough, or the on-hand stock is not replenished in a manner where patients who really need it can receive it. So if that makes sense, the patients who really do need it are being told that they can't receive it because it's being utilized by patients who really don't need it and are using it for weight loss. Now, there's no way to control that except that we put the information out there and let the patient, him or herself, know exactly what's going on and exactly what is, happening and the consequences of using this item. So I just want to make note of that and let the general public know about Ozempic. Of course, there are side effects to this particular medication, and there are some pros as well. You're welcome to visit the Ozempic website, and I have the name in the title. Visit the website and read upon it to make sure that it's the right choice for you. Again, it's going to cause weight loss, but it's utilized for weight loss in patients who have diabetes. Because patients who have diabetes have a insulin deficiency, they're more likely to gain weight, and so they are likely to have other conditions such as high blood pressure, high cholesterol, and so the body is containing this energy and storing it as fat. So the Ozempic is going to help with the weight loss and help with the insulin production. Okay, so do be aware of that. And I want to, as a healthcare provider, let everyone know and hope that everyone makes the right decision. And if you need further information, talk to your personal healthcare pharmacist or your personal doctor and find out if there are other alternatives that are right for you. There are weight loss medication tablets that are specifically for weight loss, and I do recommend those instead, like Pharmd, over-the-counter medications such as Xenocol, and then those medications are for weight loss, and they're just for weight loss only. And once a patient is deemed eligible, they can receive a prescription for weight loss. I recommend also patients eat a healthy diet and exercise at least 4 days out of the week. A brisk walk, a jog, a swim, 30 minutes 4 or 5 times a week. Getting your heart rate up to 70 to 80% of the max heart rate for yourself. Also, keep your waist circumference down. You want to do sit-ups, you want to do scrunches, you want to make sure that your waist circumference is in range for females and for males. And then also your body mass index, which gives a ratio of your muscle content to your fat content. You want to make sure that's in a right perspective. Your BMI is what it's also called, body mass index. And pharmacists are allowed to examine patients with an appointment. You can set up an appointment with your pharmacist, and they will be happy to have you to come in, and you can sit with them and they can examine your BMI and also your waist circumference to let you know where you stand, whether you're obese, overweight, normal weight, or underweight, and then whether your waist circumference is detrimental to your heart functioning and your lung functioning as well. So do be aware of that. And they also do cholesterol checks, and they do blood pressure checks as well. They do foot exams and bone mass index. They do all of that. Pharmacists, we do all of that. So do be aware of the services and products that are available. And I want you to take advantage of that. And that's why I'm sharing this information with you in this podcast. So please like, share, and subscribe. I'm Dr. Erica, okay? Take care. Bye-bye.